Thank you for choosing to stay with us. As promised, our team is pitching tent at Bungoma County as we await the 61st Madaraka Day under the theme Agriculture and Food Security. The 1st of June is tomorrow. This time it falls on a Saturday. Remember, all eyes on the county. How will it be held? Will it be successful? But I am told that Dennis Aseto is having a specific sit-down this afternoon to discuss matters health. There was historically a moment where there was serious stampede and Kenyans lost their lives. There's need to check, are we prepared in terms of health, among other issues, for these celebrations tomorrow? I want to cross over to Dennis Aseto, who will take over this mantle. And see you again for the Africa Speaks. My name is Anki Doris Umbat. Until then, enjoy the rest of your viewing. Good afternoon.
And very well, thank you very much, Anki Doris. And yes, indeed, we are coming to you from the Masinde Muliro Stadium, Kandui, where will be the epicenter of the Madaraka Day celebrations, the first 61st Madaraka Day celebrations, and the very first in this county. This, as we continue to focus and shed light in the county on what it is they are doing. Earlier, we had a conversation with the governor, as earlier alluded, on what it took to prepare this county. The county invested 800 million shillings into making sure that this location is actually ready, and the national government equally invested 800 million shillings, a total of 1.6 billion shillings. But even as we continue with these conversations, just in Bungoma County, where are we with regard to the health sector? Where are we? And those sounds behind me, those are children who are excited about the day tomorrow. They are sharing their views and their joy. But we get into the conversation that we'll be having here on matters to do with the health sector where we are in the county. And on set with me is Dr. Magrina Mayama, who is the Chief Officer, Health and Sanitation, Bungoma County. And next to her is Dr. David Wanikina, who is the Medical Superintendent, Bungoma County Referral Hospital. And on the extreme right is Dr. Ombonye Omweri, who is the MD, Hopkins Referral Hospital, Bungoma. I'll just start with you, Daktari David. Now, Dr. David, when you talk about healthcare situation in the county, where are we? You as the superintendent of the referral hospital, where are we with regard to healthcare in this county? Are the citizens happy on the services that you offer?
Yeah, thank you so much, Dennis, to have me on your channel today. I will want to say that Bungoma has made great strides as regards to healthcare. We boast of a robust system with people trusting the public healthcare system, with facilities across the county. Of course, Bungoma County has a population approaching towards 2 million Kenyans. We are still serving people from beyond this county, the neighboring counties of Busia, Kakamega, and even getting clients as far as Siaya County, coming to seek for services in Bungoma. We have a robust primary healthcare system with a proper referral mechanism for people to be referred from the lower level facilities, from the household to the referral facilities. And with the infrastructure in place, we feel that the county government has made a lot of efforts to improve the healthcare services to the people of Bungoma.
And I'll just come to you, CEO Dr. Magrina. When you talk about issues to do with our county in healthcare in the county, there is always the issue of budget allocation. In terms of budget allocation and how that translates to services that the citizens get, how committed, or rather how, or in terms of pecking order, where is that from the county government?
Thank you, Dennis, for having me. First of all, Bungoma County, as Dr. Wanikina has said, has a robust healthcare system that is trusted by many. In terms of budgeting, actually, our governor has been very committed in offering healthcare services to the people of Bungoma. That is quality. And our budget allocation for the Department of Health is actually above 30% of the county, the total county budget. Having said that, still it is not really sufficient, but it is enabling us to serve the people of Bungoma to, more than 90% of how we would have loved to serve them. Thank you, Dennis.
And I come to you, Doctor. You come from the private sector, and the private sector, when it comes to the offering of services, we have the public sector, the private sector, but that notwithstanding, you're offering services to the people. In terms of citizens accessing your hospital and also just making sure that healthcare provision in the county is actually accessible to all and affordable, where are you as the private sector with regard to offering these services to the citizens of Bungoma County?
Well, thank you for having us, Dennis. And my name is Dr. Mbonye, Director, Hopkins Hospital. Indeed, the Bungoma County has made great strides in terms of healthcare in both the public and the private sectors. And in Western region, I will say that we are the hub of healthcare because of the advancement of healthcare facilities and the kind of health partnership that we have both in the public and in the private partnership, which is supposed to add value in terms of the patient outcome in some of the things that we are going to discuss. And from the private sector, we have an adjunct services that we can help or add to the public system. For example, the referral systems. When we have overwhelming numbers, probably in the public sector, we can always have alternative care in the private sector, and we've always done that. And in the two entities, both the public and private system, we've been able to complement each other and ensuring that there are diagnostic machines which are available in either of these entities so that we are able to serve patients well. In case we do not have certain therapeutic machines, then we are able to sort them from the public sector and also similarly from the public sector. Mm-hmm. We also have special services like the intensive care unit, which sometimes is not something that can be available in all the places, and therefore this has also been one of the major and highly sought services both in the public and the private sector. Mm-hmm. And there are not so many of those services because of the kind of resource intense that they require for being set up. So we are able to partner well with the public sector. In case of periods of natural calamities and periods of intense healthcare requirements, like the COVID time that we actually all experienced in the last 3 years, the private sector came in handy because there was overwhelming cases which could not just be handled by the public sector, and therefore that kind of partnership that we've had and shown has really been of help to the citizens of Bungoma and Western region at large, among other things that we'll also discuss.
And Dr. David, as we talk about the engagement and collaboration between the private and the public sector, we come to you as the superintendent of the referral hospital. Now, here's a question where, in terms of services that you offer, recently we experienced the doctor's strike, and that really affected the services that were offered. So in terms of the hospital being ready for such shocks and just being prepared for such, what are you doing to ensure that citizen of Bungoma County does not suffer in the event that such unrest, such industrial actions do occur?
Thank you. For us in Bungoma, we have also experienced the unrest from our workers. And I will say that we have tried as much to ensure that our staff are well motivated by ensuring that we hire enough numbers and enough skills mix. We have also, the government also has ensured that people are promoted on time. and also people are paid their salaries on time. We have also seen officers being given permission to go for studies without push and pull. And that capacity building of our staff has been one of our motivators. We have also seen our infrastructure upgrades across the facilities with both equipment and also the buildings to make sure that the environment is the best for our healthcare workers to deliver. During the recent doctor strike, the issues that were being raised across for the county governments, Bungoma County government had already given all either promotions to its members, which had not been was not an issue as such. We have tried to speak to our staff to provide emergency services during strikes, and also with partnerships with the private hospitals and the mission faith-based hospitals. We've also been able to overcome the crisis that has been because of the strikes by the healthcare workers. Currently, we are experiencing a clinical officer strike and also a laboratory officer strike. But we are able to provide services because of these partnerships that we have built between the private sector and the public sector.
Let me come to you, Madam CEO. Now, you sit let's say in offices that make decisions. You are the CEO in terms of health and sanitation in the county. And when such issues to do with doctors' strike that do happen, clinical officers right now are in strike, including the laboratory officers. You can't help but scratch your head on how to handle these. So, in terms of the resident of Bungoma County sitting and say, that the county is working to ensure that this is being handled together with the national government. Where are we with that from these counties' perspective?
Thank you, Dennis. First of all, on the issue of the strike and let's say industrial actions, as leadership of the Ministry of the Department of Health in Bungoma, we have an open door approach to issues. We always engage the union leaders, and even during the strike, we have had several discussions with them. And as the medical superintendent has said, most of the issues that were raised that led to the strike, we had taken care of them. However, the workers, some of them feel because they belong to a national union, and the union has given a notice and directed them to go on strike. They kind of join in solidarity. But we have had several engagements, and I believe we are actually reaching a position where we are ready to agree and sign a document that will have our workers in Bungoma, that is clinical officers and laboratory, to go back to work. They were drafting something because we have had various engagements because there is no need of them just joining the strike because the rest of the country are striking. Yet we have catered for all the issues that they are raising in the strike. And there are some issues that they have raised that actually don't stop with us. We are still willing to engage, say, the SRC in terms of their allowances. And so we are at an advanced stage of getting them back to work. And I believe by next week, they should be back to work. We also engage the doctors as much as they were on strike, and we have implemented most of the issues that they had raised. So we always encourage dialogue, and I want to thank our union officials. They are also willing to come to the table, and so we are engaging. Thank you.
I come to you, Dr. Ombonye, now. The private sector continues to play its important role equally on providing health services in the counties. And that also goes into the infrastructure that have been put in place by the various governments for you to be able to do your business pretty much, because what you do is a business. So how is the environment in Bungoma County for you as the private sector to be able to do your business?
Well, the environment is well receptive, and there is massive support from the county government, who are the stakeholders on behalf of the national government. And we collaborate well alongside all the public hospitals around. And for us, we are accountable to the Bungoma County Referral Hospital, where we also share vital statistics to the County Referral Hospital as one of the key indicators that is supposed to help the government to make its vital decisions when it comes to matters health. For example, having statistics on mother and child data based on the outcome, based on the numbers that we attend to in the private sector. At the end of the month, we have to have reports to the laboratory, to the public health system, the patterns of disease that we receive, the chronic illnesses, and mortalities, if necessary, when they happen. We have all these statistics that we share with the county hospital, which in return has the public section that uses these statistics to build and make decisions that are also nation-based, so that we can probably have proper allocation of resources from the national government. You find that some illnesses, for example, malaria, are prevalent in Western Kenya and specifically Bungoma. And right now the government has introduced vaccines for the very first time. So those are some of the things that we enjoy as we work together with the public sector, and we attend to members of the public so that we can give the best, because we come in as an alternative or an additive health system, so that we can assist the government to ensure that its members are in health condition.
Now, Dr. David, when it comes to running the sector, say in your hospital, there's always something that you alluded to earlier, which is in terms of infrastructure, provision of drugs in the hospital. And in terms of the referral hospital that you man, would you say that you are up to capacity with regard to having these facilities, having the drugs, having the relevant doctors, the numbers that you need? And if not, what is your message to your boss, the government, even the national government?
Yeah, thank you. For us as a county referral hospital, I want to thank the executive, our governor, for supporting the hospital. Before devolution, the hospital had very few consultants. We were unable to attract specialists. Currently, we have 4 surgeons, which is for a level 5 hospital, that is a maximum. We have physicians, specialists, we have gynecologists. We are the only facility with a neonatologist in the whole of the Western region. We have an ENT surgeon. All these facilities are available here in Bungoma, which is a plus for devolution, a plus for the county government of Bungoma. Recently, the county government of Bungoma employed over 235 healthcare workers. We were the major beneficiaries. And that one shows that our executive is geared towards improving the health service delivery at the hospital. We have, the county government has constructed a 300-bed capacity hospital to address overcrowding and people sharing beds. The hospital is state-of-art, and it expands our ability to provide quality services to the patients. We have a renal unit, courtesy of devolution. We have an intensive care unit. We have a cancer center. We have the best eye unit within the region. If you look at the amenities, currently we under construction, we have a regional blood bank that is coming up. We have an intensive care unit hospital coming up at Webuye County Hospital. So if you look at the amenities that are coming up, plus the equipment and the personnel, including the trainings, it means that we are headed in the right direction. We, of course, like any other institution, we face challenges. Infrastructure is a big challenge. We don't have a mental health unit, for example. We don't have a pathology lab. We don't have a CT scan, an MRI, which are essential for us as a level 5 hospital to provide our services. So we are looking forward to a time whereby all these amenities will be availed to us so that we can further enhance services to the people. So as a county referral hospital, we are heading in the right direction and we can only be better.
Be better.
Yes.
And I come to you, Madam CEO now. There is a lot that Dr. David has talked about, the good part of the investments that the county has given into the hospitals. But I come to you in terms of making sure that the services that he's talking about is not only available in the CBD or in the major town within Bungoma County, but that citizens of this county are able to get these services, able to get healthcare services in the counties, the sub-counties and wards where they are in. So in terms of just making sure that we take these services to the people where they are, what is the county doing in making sure that the clinics, the dispensaries that are in this county do operate at full capacity, at maximum capacity? They have drugs, they have the doctors, nurses that they require to be able to operate.
Thank you, Dennis. First of all, the medical superintendent mentioned that after devolution, we have made tremendous improvement in the healthcare sector. Before devolution, for instance, we only had like 2 specialists at Bungoma County Referral Hospital and 1 surgeon at Webuye. Presently, we are having, and we only had like 2 theaters. 2 theaters in Webuye and 2 theaters at Bungoma. Presently, we have 9 out of 11 hospitals with theaters. We have not been able to operationalize 2 of those theaters, but we are working to equip and operationalize, but we have constructed. So we want those people who are away from the CBD to be able to access those services. We have a referral system in place where some of our specialists reach out, like our eye specialists, they go out to all the sub-counties. They arrange and reach out and go and operate on patients in the respective hospitals. We have hired a number of specialists, and presently even Kimilili has a surgeon. We have a family physician all the way in Naitiri with a theater, and we are looking to get more specialists to send out there. About the wards, we have constructed quite a number of health centers, and presently we had 20 health centers, but as at now we are having 37 health centers. Out of 37 wards, I think we might have just about 2 or 3 wards that don't have, maybe 5 wards that don't have health centers. And we are having 154 dispensaries. So every ward at least has a health facility. Apart from Halaba ward, which is just next to this ward, it is within the town, next to the township. So it is depending mostly on private facilities, but we have a plan. In fact, the area MCA has purchased land to have us construct a health facility. We are really working as government to ensure that all citizens are able to access health services. Thank you very much.
And I come to you, Dr. Ombonye now. Daktari, for a very long time, the private sector, Kenyans has painted this picture that it is not accessible and not affordable. So from this county, in terms of the private sector offering these services to Kenyans, yeah, because you're equally serving Kenyans who need these services, what are you doing to ensure that things like, now we're going into SHIF, NHIF, and all these other services are offered in your hospital? Because Kenyans want to come with these cards to you to be able to get services. Does that work where you are? And if not, how do we then have this conversation such that provision of universal health care can also be received at your facilities?
Yeah, so the universal health care is one of the things that we're now focusing on, and this discussion is very necessary, that we must be part and parcel of this service provision, because the universal health care coverage means that we must reach out to as many people as possible, and the participation from all the healthcare providers must be geared towards preventive or primary health care. So through the provisions which have been given in terms of the insurances and what is now coming on as the Social Health Insurance Fund, we are aligning ourselves so that we can get proper guidance by the government through the Ministry of Health, so that we can also continue with the smooth services as we've been giving, and even in a better and advanced way, so that we can have all the Kenyans accessing healthcare in a very affordable manner. The facilities notwithstanding. For a long time, people have been having a notion about high expenses in the private sector. And when you come to Bungoma, some of our facilities, you realize that we are extremely cognizant of what is happening, and we are very affordable in terms of healthcare. For those patients who do not have a coverage, sometimes they have to pay from their pocket, and we must ensure that what they are paying is a subsidized rate. Just like you will go to the government facility, these patients must access services beginning from consultation. When they go for workups in the laboratory, there is no exaggerated figure that we have in some of our facilities, like what we have here in Bungoma. So that is what we have ensured, that we have people access healthcare affordably and without causing trouble in terms of, when they are not able to pay. We must still look at all the avenues of how to help these particular people. And lastly, sometimes when it comes to emergencies, as we are guided by our ethics and professionalism, we've always come in and assisted, and every citizen, as guided in our constitution, every citizen is entitled to the highest attainable health care in emergency situations without minding about the ability to pay. So as we stabilize patients in that particular manner, and then we can later look at the avenues of probably referral or any other as per the guidance of the relatives and the patient as well.
And because we're running short of time, Daktari, I just want you to briefly, in a minute, tell us, with the Madaraka Day celebrations coming to this county, what are your expectations of the president with regard to healthcare in this county? Briefly, in a minute. Speak to the president.
His Excellency the President, Dr. William Samoei Ruto, as Bungoma County Referral Hospital, we request you, number one, if you can equip for us the 300-bed hospital. Number two, if you can provide for us a CT scan and an MRI. And also, we partner in terms of making sure that we have a mentor unit. It will go a long way towards making sure that the hostel provides services to its people.
And I want to thank you, ladies and gentlemen, for making time to be here. That is, on the extreme end, Dr. Ombonye Omweri, MD, the Hopkins Referral Hospital, Bungoma, and Dr. Magrina Mayama, Chief Officer Health and Sanitation, Bungoma County, Asante Sana, and Dr. David Wanikina, who is the Medical Superintendent, Bungoma County Referral Hospital. Now, as the Madaraka Day celebrations, the 61st, comes to this county, healthcare continues to be a subject, and as we've heard from the medical professionals, there is a lot that is happening. The private sector working together with the public sector in making sure that the citizens of this county continue to receive the healthcare services that they deserve. And even as the president is coming here tomorrow to officiate and to preside over the 61st Madaraka Day celebrations, healthcare, Dr. David says and requests that the president comes and give them the bed capacity that they need, the CT scans that they need, so that the people of this county can get the services that they need. My name is Dennis Aseto, and remember that we are pitching camp in Bungoma County, to be specific, the Masinde Muliro Stadium in Kandui, as we bring you blow by blow, beat by beat coverage of the 61st Madaraka Day celebrations across the day. Today we shall be having other conversations equally from the governorship of this county on where we are, on where the county is headed, the future of the county, how they're working together with the national government, but that in a subsequent news bulletin, and as we continue to give you the county focus of Bungoma County. From Masinde Muliro Stadium in Kandui, Dennis Aseto, back to you in studio.